So welcome to another live session of our show, Sugar Smart. Today the topic of our live session will be impact of diabetes on eye health. Hello, Dr. Aditya. How are you?
Hi, hello. Can you hear me?
Yes, sir.
All right,
Perfectly.
perfect,
Okay.
perfect.
So before going ahead, I would just like to give a small introduction about diabetes and Dr. Aditya as well. So diabetes is a widespread health concern that affects millions of people worldwide, and its repercussions extend to various aspects of our well-being, including our eyes. In this session, we will delve into the connections between diabetes on eye health, exploring the risks, symptoms, and preventive measures. To shed light on the same, we have Dr. Aditya with us today. And thank you so much for coming live with us, Dr. Aditya Sethi. Okay, cool. So let's start with the live session. The first question for today's live session is, sir, what is macular edema and what are its early symptoms and signs?
I thank you for having me here. Um, we know a bit about diabetes in the eye now. What happens with diabetes is that because when we have high sugars, there are larger chances of having blockages in our small vessels. So the eye we already know is a small organ. So it has small vessels around the retina, which is the brain of the eye, or the connection between the brain and the eye. So retina is a very sensitive neurosensory layer, and that's where the small vessels start getting clogged. And when they start getting clogged, the blood supply of a particular part of the retina goes down, and that can lead to hyperpermeable or excessive leakiness of cells around, and there can be accumulation of fluid. If this happens at the central part of the retina, where you get the maximum number of neurons or maximum vision, that can cause macular edema. Because that's
Okay.
the macula. And that swelling of this area is basically diabetic macular edema, which happens because of the high sugars. And that can cause symptoms like blurred vision. Your lines can be affected, that you won't be able to read lines properly. You won't be able to do any near work properly. Your vision suddenly drops down. There can be a scotoma or a dark spot in your visual field. All these factors starts happening. So that leads to a drop in quality of life, and that leads to vision drop, even though everything else may all be fine in diabetics. And that's something that we can only be prevented if we do regular checkups. So the problem with diabetics are that we often go to our endocrinologist, we go to our diabetologist, we take our medicines for sugars, but we fail to come to an eye specialist, and that failure can lead to sight loss. So that's the awareness we have to send out there. That's the message, that if you have diabetes, even if it's well controlled, once a year, get a retina checked, get a fundoscopy, because there are two factors we know, is how much your sugars are and how long do you have diabetes. Both can happen. So even if you have well controlled sugars, but you have diabetes for say 15 years, the chance of you having diabetic retinopathy is still there. So it's best to check even if your duration of diabetes has been long.
Okay.
Yeah. I hope I was able
Okay.
to give some answers.
Absolutely.
Yeah.
Absolutely. Okay. So moving on, does diabetic retinopathy play a role in the development of this progression?
Yeah. So diabetic retinopathy is when the entire retina, not just the macula,
Mhm.
even the peripheral retina, that also ends up having blockages, small. So it's not always that the center will get affected. So sometimes you can have subtle signs on the sides of the retina as well. So retina, common man knows as parda or curtain.
Hmm.
है Parda basically doesn't have a central part, it also has some periphery. So that periphery also can have small vessels or bleeding points, and that can lead to hemorrhages in the retina. That means in that colorless fluid between the retina and the front portion of the eye, you can have blood. And if you have bleeding there, again, that can be a reason for your contrast going down, you not being able to see very well. You may need extra lighting in the room to see. So diabetes can cause multifactorial things, multiple things that can happen, and the whole disease together is called diabetic retinopathy when the retina is involved. So yes, and so sugars have to be controlled whether you like it or not, and these things have to be addressed before they cause damage.
Hmm. Okay. Perfect. Okay, moving ahead. In cases of cataracts, is a person with diabetes more prone to cataract development?
So कैटरैक्ट या मोतिया वो चीज होती है कि द लेंस इनसाइड द आई दैट एजेस फास्टर. और डायबिटीज में क्या होता है, बिकॉज ऑफ हाई शुगर्स वी जनरली द इंटायर बॉडी एजेस फास्टर. सो इफ somebody इज सपोज टू गेट कैटरैक्ट एट 70s, किसी को अगर 70 साल पे कैटरैक्ट होना है, तो डायबिटीज की वजह से इफ इट्स अनकंट्रोल स्पेशली इट कैन हैपन इन अर्ली 50s or even 60s. So it happens much earlier. And the type of cataract that also happens is a more hard cataract, and it affects the central core more. So vision पे directly affect पहले ही कर देता है, because normally cataract starts from the side, goes to the center, but diabetic cataracts often affect the center also
Mm-hmm.
first. So
Okay.
the effect of the cataract or the quality of life suddenly dips because of high level of accumulation of a um, sub element called sorbitol. एंड दैट पाथवे की वजह से, उसके ब्लॉकेजेस की वजह से, बिकॉज हाई शुगर्स, अब बॉडी को पता नहीं है शुगर कहाँ कहाँ स्टोर करूँ, तो लेंस बिकम्स द साइट फॉर स्टोरेज ऑफ दीज शुगर्स एंड दैट कॉजेज कैटरैक्ट.
Okay. Okay. Are there any particular types of cataracts that are more preventive about diabetics than others?
So yeah, like I told you, the cataract जो diabetes का होता है, it's very
Mhm.
peculiar. It's a harder cataract, happens earlier, and in some patients they complain faster also, because not just the cataract, उनका tear film, उनका retina, everything gets affected together. एंड वंस दिस कैटरैक्ट स्टार्ट्स हैपनिंग, जब ये कैटरैक्ट बनने शुरू हो जाता है, तो पेशेंट्स क्वालिटी ऑफ लाइफ एंड जो विजन होती है वो सेम नहीं रहती. सो द टाइप ऑफ कैटरैक्ट एंड व्हेन डू वी इंटरवीन इज वेरी इंपॉर्टेंट इन डायबिटीज, की शुगर्स एक बार कंट्रोल हो जाए, बिकॉज ऑफन हम एज सर्जन्स वी फील कि अगर शुगर्स हाई हैं तो चांस ऑफ इन्फेक्शन आफ्टर सर्जरी इज मच हायर. सो वी वांट टू कंट्रोल द डायबिटीज, द ब्लड शुगर लेवल. वी वांट टू मेक श्योर कि कोई किडनी में प्रॉब्लम या हार्ट डिजीज ना हो, उन सबको भी देखना पड़ता है. एंड देन वी हैव टू प्लान द प्रोसीजर. सो इट्स नॉट जस्ट कि कैटरैक्ट है सर्जरी करा लो, इट्स ऑल्सो द होल प्लानिंग कि शुगर्स कैसा है, how
Mhm.
hard is the cataract, what is the settings, or what sort of procedure am I going to do,
Mhm.
what sort of, again, the choice of lenses also in this cataract surgery will differ. You will not go for something very premium, because you know कि बाद में जाके retina में अगर problem होना है, so that these lenses are going to be contraindicated later. So we go for, we have to make a lot of decisions with the patient together, and very case based. It's not one size fits all again. So वो सब discussions are very important. So that affects की cataract का outcome, and how the cataract is, everything matters. So that has to be assessed. I hope that was the
Okay.
question and I answered that.
Yeah, yeah.
Okay.
Okay, so before moving ahead, I would just like to inform my audience and to you also, Dr. Aditya, that we have a community group on WhatsApp that is
Mhm.
supportively of diabetes. And in
Yes.
case anybody from the audience would like to join it, you can just comment below. We'll definitely share you a link, or we also have the links in our bio, right? So we would love to share the information. Okay, perfect. Moving ahead, what are the potential challenges in cataract surgery for people with diabetes, and are there any specific precautions or considerations that should be taken?
Yes. So as a surgeon, what we think of is with diabetes is that sugars, like I mentioned already, कि sugars control में होने चाहिए before and after the surgery. Before, because we don't, we've noticed that when the sugars are high and we operate, the chances of the vision coming back, or improving instantaneously are less. It takes longer for the patient to get better. That happens because जब high sugars में surgery होती है, especially cataract surgery, macular edema के chances बढ़ जाते हैं.
Mhm.
What we discussed in the first question, post-op macular edema के chances बढ़ जाते हैं. So it's very important to address that. Secondly, हर डायबिटिक में रेटिना चेक भी करना बहुत ज़रूरी है बिफोर एंड आफ्टर द कैटरैक्ट सर्जरी, बिकॉज इफ देर इज अ प्री एग्जिस्टिंग hemorrhage or a chance of an hemorrhage, we may want to give an injection along with it, along the cataract surgery, because we have now availability of a lot of injections,
Mhm.
which are basically anti-VEGF injections, which help prevent bleeding inside the retina, which is secondary to diabetes. So we may want to add that along with the cataract surgery, so that the patient recovers from both ends, not just the cataract. Like we know, cataract is a problem of the anterior part of the eye, मतलब आगे की तरफ, the anterior camera, and diabetes or diabetic retinopathy is more of the retina, which is the nerve of the eye. So we have to think of both the sides. Also, glaucoma becomes a complication of diabetes. So we have to not forget to assess the nerve as well. So proper checkup goes a long way in these situations. It's not just cataract, cataract surgery kar lo and life will be fine. No, you have to think of the whole eye. And yes, the laser time, I would always prefer diabetics not to wait too long, because if you wait too long before you go ahead for a cataract surgery, we can't see the retina very well. We are assuming the retina is fine, or we are doing a B scan or ultrasound, which gives us a 60% picture of how the retina is, and the fine points get missed. So यही अगर patient जल्दी आया होता, I would have been assessing the retina, I would be assessing the nerve, I would be very confident in saying, okay, if I do this, I'm making a difference for the positive in the patient's life. But if the same patient comes with a hard white cataract, which happens very fast if your sugars are not controlled, like a normal progression, like I told you, could be over years. In diabetes, this progression can be over months or days. So that fast progression can also cause problems. So yeah, assessing and deciding is a little different in diabetics than a regular non-diabetic.
Okay, so we need to be more
Yes.
careful if a person is a diabetic,
Yeah.
right?
G, G,
Okay.
G.
Okay, coming on to the last question for the session today. What are some preventive measures to reduce the risks of conditions like macular edema and cataract?
Yes. So I think it goes back to the same basic point that you have to control your sugars.
Mhm.
If you're controlling your diet, or if you're having your medicines on time, depending if you're type 1 or type 2 diabetic, I think if you're doing the basic and also following up with your eye specialist and getting a retina check once a year or once in 2 years, depending on how you've been advised, I think that's enough to make sure that you do not become a diabetic retinopathy patient. And also nowadays we have new molecules which are coming in. So even if you are a diabetic retinopathy patient, there's a lot of new research which is happening internationally as well as in India, and new molecules are coming. Just now a new injection has been launched, which prevents any complications of these diabetes or even helps recover from diabetic retinopathy. So as a patient, what I can suggest is that watch your diet, exercise as much as you can, maintain a good sleep pattern, don't uh, don't extend your working hours, and at the same time, dryness is something we don't talk about with diabetes. Diabetics are more prone for dryness, so the room you're sitting in, make sure it's more humid. Make sure your diet has the right antioxidants, because diabetes is increasing your aging and antioxidants are required. So have the fresh fruits, vegetables, and if you do all these basic household home remedies, you can definitely be on track for your diabetic treatment as well.
Okay, okay. Would you like to quote some main diet or maybe some
I
important
think
things in food that we should eat?
yes. So India has a large population, and India is probably number one in the world for diabetes. And it's more urban than rural. A lot of times it's called a rich man's disease because it
Yeah,
happens more in urban. And the reason it's called that is because our urban lifestyle, matlab, staying in Delhi or staying in Bombay or staying in Bangalore, the lifestyle we live is more sedentary. मतलब हम ज़्यादा एक जगह बैठते हैं. We don't really exercise too much. We don't go out too much. We don't even now go out and buy our
yeah.
groceries. So that has to change. And if that doesn't change, we are more prone for diabetes. Secondly, the junk food we eat.
Mm.
Zomato, Swiggy, all these other companies have become really good for all of us, but at the same time, they've promoted junk food,
Yeah.
and it's easier to buy a burger than get a khichdi. You know, that's what
Right.
causing a change in our lifestyle, and
Mm.
that change in our lifestyle has some price to pay, and the price to pay is your health, unfortunately
Yeah.
here. So it's very important to do that. Also, smoking, uh, being in a polluted environment, all these things have also played little role, but that little role has added in a compound effect to make sure that we are getting more and more like the past American population of overweight, sedentary lifestyle, leading to more type 2 diabetes in our country.
Yeah.
So वो बदलना पड़ेगा. We have to figure out how we do that. And as far as food is concerned, the balanced diet which was taught to us in school that still exists. So
Yeah,
fresh vegetables, fresh fruits. If you do that, then I think you should be fine.
perfect. That was a very informative session for all our audience,
Yes.
right?
Thank
Okay,
you so much.
do
Uh,
we
do
have
you have
any
questions?
questions in the comments? Uh, Anybody with any questions? I don't think so. We have any. Okay,
Or
perfect.
I can
Thank.
point out one more thing about
Sure.
diabetes.
Yeah.
If you have high sugars,
Hmm.
there's always a change in your glass number. So that can
Okay.
be a sign. So if you're somebody who has a frequent change of your spectacle glasses and you're maybe an adult, you can think of diabetes as one of the things you may have to rule out.
Okay.
So yeah,
And
as far as the eye is concerned,
usually,
that's
mhm, and usually, in how much time can we expect the change for a non-diabetic person?
so with um non-diabetic. Generally, the number stabilizes when you're about 18 to
Okay.
21.
Okay.
So whatever your
But
number is from that age till you develop a cataract, it's generally the same. When you're about 40, 45, of course, you need reading glasses.
hmm,
That's very natural, that's aging. But at the same time, the change in between that stage is almost negligible to zero. There's no reason that you should have a change because the architecture of the eye is already made. But in diabetics, what happens is that because of fluctuating sugars, there can be fluctuating position of the lens and other things, and that can cause a change in your refraction. And if that happens, that's another reason why, that is another indicator that you may have diabetes and you have to rule that out. So, as far as the eye is concerned, that's a good pointer.
okay. Cool. Thank you so much, Dr. Aditya, for coming live
Thank
with
you
us and also for all the
for having me.
collaborations you had.
Yeah,
Yeah, absolutely.
thank you for
Okay,
having me.
thank you so much to the audience
Bye.
also for being here. And in case if okay, we have a question. Can diabetes cause severe cases in eye like blindness as well?
Yes. So, diabetes related blindness is quite common.
Mhm.
That's why we prefer to get a regular preventive checkup because often diseases like glaucoma or diabetic retinopathy or macular edema, they can be missed because it could be either in one eye more than the other eye. So your life may not be, a struggling life of a blind person or any of that. So it's very important to get a regular checkup, and they can be arrested and treated and
Mhm.
reversed. But if we are late to the party, then often we've seen patients lose their vision permanently as well,
Okay.
because these are retina and the nerve is a part of the brain, and we know once brain tissue is affected, it's very difficult to get it back. So it's very important to prevent treatment.
Okay. I hope you got your answer. Okay, perfect. So before ending the live session, I would like to inform my audience that at Thrift Media, we are dedicated to delivering expert health information for your well-informed choices. And we would request you to please, avoid any unreliable health advice on social media. And you can follow us on our social media platforms and on YouTube as well. And in case if you wish to, get added to our WhatsApp groups, you can find the link in our bio. Remember, when you know better, you live better. Thank you so much, Dr. Aditya.
See you. Bye
Sure.
bye.
Okay, bye bye. See
Bye.
you.